Not all fevers are normal or viral fever. It could be dengue fever also. Just know about what is dengue fever, how can you diagnose it earlier, what are the warning symptoms when you should go to hospital. What is dengue fever? It is a viral fever. There are some viruses called dengue virus. There are 4 serotypes of viruses available. Dengue 1, 2, 3, 4. So all those viruses, when somebody is having dengue fever, they have those viruses inside them. There is a mosquito called Aedes mosquito, which is just used for transmission. They will come and bite, and all the viruses go inside the mosquito. And the mosquito will go and bite to some normal healthy people. So in that way, the dengue virus spread. It doesn't spread with touching, it doesn't spread with any other way. When at the time those dengue mosquitoes or the Aedes mosquitoes comes, usually in the daytime. So those are also known as a daytime biter. How will you differentiate between a normal fever or a dengue fever? Usually dengue fever is also like other viral fever. So they will also have a fever, body pains, but there are some specific symptoms like retroorbital pain or pain behind the eyes. Those are very classical for dengue fever. Or this is also known as a break bone fever. So you'll have a extreme fatigue, extreme body pain, bone pains. So people will go for painkiller also. So that much painful it will be. Sometimes it can be associated with rash, which usually be in the later stages. Sometimes people can have vomiting also and abdomen pain also. So what are the warning signs you should be seeing? 1. If you are continuously getting abdomen pain or persistently you are vomiting. Second, if you are having dizziness, your unsteadiness, unable to focus, confusion. Third, if you have any bleeding coming from the nose or gum, and if you are getting brownish color stool or black color stool. Fourth, if you are having urine which is very dark in color or your urine is coming very low. Fifth, if you are having breathlessness, very difficulty taking breathing. These are the symptoms when you should be definitely visiting to a doctor. Now let's go little the natural time of the dengue fever. Actually, the dengue is having 3 stages. The initial stage is called febrile stages. In febrile stages, first 1 to 4 days, usually we will have very high grade fever, more than 102, 103, 104. Along with that, you will have dehydration, nausea, vomiting. After 3 to 4 days, it is called critical phase. Though the fever comes down, but that is when the other danger comes. So the low platelet, the platelet coming down, or you to get water in your abdomen or water in the lungs, breathing difficulty, vomiting, all those start in this stage. So this is the danger sign. So usually we say that 4 to 8 days is time when we have to be continuously under follow up. After 8 days, it is a recovery phase. That time, sometimes some people can have second peak of temperature, a little bit of more temperature at that age. And other than that, on this recovery phase, you can have fatigue, lethargy and all. What you should do? Do we go to doctor every time when we have fever, or in every dengue fever do we have to get hospitalized? No, never. Dengue fever is also like a normal viral fever. More than 70 to 80% with just normal paracetamol and hydration, it will be fine. There is no role of antibiotic in viral fever. Except there are some special cases when we suspect about any secondary infection. But that has to be taken, the decision has to be taken by a professionals. Now, do we have to worry about platelet count? When do we have to worry about platelet count? If you are getting abdomen pain, if you are getting black color stool, if you are getting bleeding from the nose, if you are getting rash, yes, you have to be worried about it. Other than that, you don't need to worry about platelet count much. More than that, which is important for a doctor, is how much is your BP, how is your pulse rate, how is your saturation, how is your oxygen, how is your liver enzymes, how is your CBP hematocrit. Those are all important things to look, and that will all check the severity. If somebody is having low platelet count, less than 50,000. Does it cause a severe dengue? No, we cannot say severity of dengue just by seeing the platelet count. Platelet count can be very high or normal, then also the person can go for a severe dengue. Now we will come about what kind of diet a person should take. First, if you don't want to eat, don't force feed yourself. The digestion will be very slow during any fever, and especially even definitely in dengue fever also. But hydrate. Drink more water, ORS, soup, coconut water. Drink more and more water and hydrate. Hydration and temperature control, those two are more important in dengue fever. So if you hydrate yourself, take paracetamol and just take rest. Usually many of the people will become better. But few of them definitely under observation of a professional. But few of them sometimes become severe, and that time they have to go to hospital definitely for sure. Now, few and very known question that we ask is, what about papaya leaf juice? I know it is a very hot topic for everyone, but there is no much of evidence about it. If you want to take, it's up to you, but that doesn't have much impact. What about kiwi? What about papaya? Those are not contraindicated. You can easily take kiwi or papaya, but that doesn't increase your platelet count. Even if you don't take papaya or kiwi, after 3 to 4 days, the platelet is going to increase. Do everybody need platelet transmission? No. The decision has to be taken by a profession. Things that you should be avoiding in a person who is suffering from a dengue. As we discussed earlier, dengue is also known as a breakbone fever. So many of the time people take painkiller, ibuprofen or any other. Please avoid all those things. That can also increase your gastric ulcer chances, that can also increase melena, and that can also, if somebody is in serious or any severe dengue who is having decreased urine output or whose kidney is already compromised, that can also impact on the kidney function. Second thing, avoid intramuscular injection. Many of the time when the fever is very high, doctor will suggest you for the injection, paracetamol injection. Go for a venous injection than an intramuscular injection. And don't treat by yourself. Please take an opinion of a professional before you start any self-medication. And fourth is, definitely do hydration, but not so much over hydration too. What are the tests to be done? Usually, dengue initial stage 1 to 5 days, NS1 will come positive. And after 3 days or 3 to 7 days or after that, IgM come positive. So initially IgM may be negative, and after 5 to 6 days NS1 may be negative. So it is very important when you are doing a blood test that which stage of the day or which day of the fever you are doing the blood test. Better to do all the three, IgG, IgM and NS1, along with other things like CBP, how is your hematocrit to check, and along with CBP, hematocrit, WBC counts, platelet counts, along with that how is your liver function test, all those things has to be taken care. Thank you.